All right, let's bring in John. Beaudoin. For those who may not have seen our first interview, but who are you?
Yeah, I'm an engineer with an MBA. I'm a generalist, really. It's hard to explain. Everybody says, what do I call you? Like analyst? I don't know. Everybody says, oh, you're the data guy. I can't stand data. I only do it when other people are not doing it.
Tell us how you got into data analysis as relates to stats for COVID.
I realized right away, I think it was about 5 days into the purported pandemic, that I downloaded a file from the CDC. The numbers didn't add up between pneumonia and influenza, and then all cause. And so when I wrote to the keeper of the record at the CDC, they took the file down. And when they put it back up, there was no error. But they didn't change the math. They changed the data. And that was a 2014 through 2018 file. It's confusing, and I don't have any proof of it, but that is how I got into this. I recognized that they were lying and cheating, and I can't prove it. So I don't generally talk about that particular incident other than to say that's how I got into it. So I sued the governor over the mask mandate. He was afraid of my particular complaint. So he rescinded the order for the whole state, and he reissued it with an exception in paragraph 2B to get around my lawsuit. And my lawsuit was that I'm deaf in one ear, and you're depriving me of receiving free speech from others because I can't see their lips move because you ordered them to cover their mouths. Paragraph 2B in Order 55, it says, by or between people hearing impaired, neither of you have to wear a mask. That was just to dismiss my case on standing because I no longer had a particularized complaint. And as far as the numbers, I went to law school for a year. They kicked me out for not getting the vaccine. That was at 56 years old. I'm 60 now. I would have been a lawyer a year ago, but I got kicked out. They said a little girl died on the news. She was 7 years old. Her name's Cassidy. She's the first chapter in my book. My book's over my head here, right there, therealcdc.com. I was like, no way. There's no way a healthy 7-year-old died. So I got the records, and sure enough, it said she died. But then I found a VAERS record. I correlated it, and I found out she actually reacted to the vaccine in 5 minutes. She threw up for 8 to 10 hours. They gave her a second one. She had severe abdominal pain, 103-degree fever, didn't have a bowel movement for 3 days. I believe it's the same girl in both records, and I have all the death records from Massachusetts. That's how I got them on a public records request.
You say they gave her a second jab. Within what proximity to the first? Like the reaction was after the first or the second?
Well, both, but there's no time frame on the first one. The second one, she was injected on January 13, 2022. But the first one has to be at least 2 weeks earlier.
They say 7-year-old girl who died of COVID laid to rest. She touched so many lives. This is from February 11, 2022. A Massachusetts community is mourning the loss of a 7-year-old girl who died last month from complications arising from COVID. What did any investigation reveal in terms of her death?
Nothing. I found the VAERS report. I have all the death records in Massachusetts. So I have every 7-year-old girl in Massachusetts who died in and around that time. And the other 3 of the 4 7-year-olds, they don't fit the time frame. Cassidy fits it perfectly. That's actually part of my lawsuit against the state, the governor, the public health commissioner, the chief medical examiner, and 4 individual medical examiners for fraud. I'm asking, is that her? Because I know it's her, and they know it's her. They fought it, of course, and there was a motion to dismiss, which was allowed, and now I'm in the First Circuit Court of Appeals on appeal.
What are the details on her death certificate, which we don't know if they correlate? But
because I have all the records, here's what I can do. It says exactly in Part 1 of her death record, and that's the causes of death. Part 2 is other potential contributing factors. So Part 1, complications of coronavirus 19 viral infection. That's it. Nothing else. It doesn't say what the complications are. Doesn't say pneumonia. Doesn't say anything. That's Michelle Matthews, one of the named defendants in my case. Michelle Matthews wrote that, I think it was 22 times.
Where did she write it 22 times?
On 22 different death records. She's a medical examiner, so that means she does probably close to 400 a year on average in Massachusetts, the actual full-time medical examiners. And out of those, let's say she certified, what did I say, 22? I think it was 22. She always used that same phrase. And nobody else in the medical examiner department in Massachusetts used that phrase. All but 5 of them, there's nothing else listed. That's the level of detail I have. I have 1.4 million non-redacted death records. I'm the only one in the world who's looked at it in that manner.
How did you get the death record?
In Massachusetts, I asked for them. I did a public records request, and they said, you don't need to do a public records request. So I just asked for them. I got the Minnesota ones from somebody who did the same thing. So she got them from Minnesota. And then in Connecticut, I am doing a research paper on the regional effects of temperature and humidity versus heart disease for Connecticut. And so I submitted an application to do a research paper on the regional effects of climate change versus heart disease in Connecticut. The research study was approved, and they gave me all the records in Connecticut. And my incidental findings are that I found all kinds of other stuff. I'm not committing fraud because I am doing a research paper on that. There's a guy at MIT doing it right now.
Well, actually, just back to Cassidy. Her name is Cassidy Baraka.
Yes.
7 years old, passes away. Death certificate says complications arising from COVID infection.
Yes, in part 1. In part 2, it says asthma, fungal and bacterial pleurisy, which I believe was from wearing a mask 5 days a week, 6 hours a day. She died with fungal and bacterial pleurisy, both of which would occur from wearing a mask in front of your face for 6 hours a day.
You've never reached out, or have you reached out to the parents?
No, I was going to, but David, this is conjecture. The Department of Children and Families was called 2 weeks prior to that because an EMT had been in the house and apparently reported some kind of conditions in the house. I think a lot of junk laying around maybe. Department of Children and Families never showed up. Channel 5, I think it was, went to her doorstep, knocked on the door to ask her about that after her daughter died. That's an evil reporter who would do that to a parent who lost her child, to ask, why was DCF making a call here? They were trying to, I believe, threaten her that DCF's going to do an investigation into you if you don't drop the fact that the vaccine killed her. I'm asking them to admit the fraud, stop committing fraud, and correct the old records. And when I say fraud, I mean, I found well over 100 accidental deaths, such as blunt force trauma to the head and torso, acute fentanyl overdoses. They tested dead bodies for COVID, and they called them COVID deaths. And they ran up the numbers for COVID death to make everybody afraid of COVID. And I caught them. So I'm asking them to admit that publicly, make some press releases on that, and tell the people the truth. Also, correct the records of the vaccine deaths. And I found many vaccine deaths correlated to the VAERS reports. Cassidy was only the first one. There's one, Brianna McCarthy, who was 30 years old. She was an English teacher, and she reacted within hours to the Moderna vaccine with a terrible headache. She went to the emergency room twice in a few days, and they told her, the emergency rooms for COVID patients, you only have a headache, go home. She was having a stroke that whole time. She ended up dying from the stroke. She had seizure, paralysis, brain dead within a few days, and was taken off life support after a couple of weeks. What they wrote on her death record is that she died from a stroke that happened from COVID. But there's a brief report from the Neurohospitalist Journal, which is 6 doctors from Harvard Medical College and Beth Israel Deaconess Medical Center. The title of the report is Fatal Post-COVID mRNA Vaccine Associated Cerebral Ischemia. It means the vaccine killed her by stroke. Every paragraph says the vaccine killed her by stroke. Yet there's no mention of the vaccine on her death record until a couple of months ago, which is 3 years after she died, because a family member had been contacting the state over and over trying to get the death record to reflect the true cause of death, which was the vaccine. So you have the state telling people that people are dying from COVID by writing it on the death records like Cassidy and like Brianna McCarthy, when they really died from the vaccine. And they're hiding the vaccine deaths. In some of my other documents and books, I've documented the fact that the CDC has been deleting vaccine as a cause of death from death records, hiding them from the American people, and then lying and saying all they know about is the 9 Johnson & Johnson vaccine deaths, which is a lie. They're caught.
For Brianna, did they end up updating her death certificate?
Yes, they did.
What are they amended to, or amended to include?
Just COVID vaccination, but they put it in front of COVID. So the last thing listed is the underlying cause of death. So in the causal chain of events that cause death, you go back to the root cause, they're still saying the root cause is COVID. In the brief report by the doctors, they stated that she was asymptomatic and tested positive for COVID 3 months earlier. So 3 months earlier, they have a positive COVID test. They're attributing the death as the underlying cause still to COVID. COVID, I don't know how it can cause a vaccine. If you read through the list, COVID caused the vaccine that caused the stroke. I know it sounds strange.
And so you got the updated death certificate.
I had a beer with her dad. He told me it was updated. I think I actually have it.
You've been collecting this data for a long time, since early on. You mentioned the influenza versus COVID.
It's a red herring. Even if you take the worst flu year in the past 20, 30 years, it's still only 8% of the COVID deaths. They stole influenza deaths. Yes, they did. They stole car accidents, motorcycle accidents, fentanyl overdoses. They killed people in the hospital with certain National Institutes of Health drug COVID treatment programs. I get into the laws and the dates and what they died from. They killed hundreds of thousands of Americans, about probably close to 500,000 from hospital homicides to drive up the COVID death numbers. Flu is part of it, but it's a real small thing that people harp on. It's really a red herring.
The worst flu season, I think, was, give or take, 2018. It was 60 to 80,000 flu deaths in America.
Yeah, it was nothing. It's like 8% of what they purport COVID to be. Yes, it's true. I try to focus on like more big numbers and root causes, and I find that the smaller ones that people they're led to believe that and talk about that, when the reality is it's only 8% of the deaths, David.
What is the what's the total number of COVID deaths that they're?
I've lost track. It's like probably like 1.3 or 4 million. And this is United States only. I think that's what they're saying, and it's probably 80 to 90% fraud. They didn't die from COVID.
The argument at the time was that the stat was that there were multiple comorbidities, so that the average person who passed from COVID had multiple comorbidities. When you're getting the death certificates, that is what you're seeing on those death certificates?
Yeah, well, if you want to call a comorbidity a fentanyl overdose, I mean, that's not a comorbidity. That's a lie that they died from COVID. The problem with writing COVID on a death record where COVID had no causal relationship to the death, okay, is that it is fraud. Now, I don't care if the CDC in report number 3 or alert number 2 that came out in March and April of 2020, tell the doctors what they can write on the death record. They actually say right there, it should be causal in the chain of events to cause death. It says it in the literature from the CDC because it was incentivized under the CARES Act. If they write COVID, the hospital gets money. So the pay plan defines the behavior. You have an incentive pay plan causing the behavior of doctors and people, and they're not going to get prosecuted. David, that's federal felony fraud. 18 USC 1035 and 1040 and 1343. Those are all fraud crimes. Fraud and disaster relief, false statements in healthcare matters, and fraud by wire. Those are those 3 laws. We're talking like 5-year felonies that they commit every single day. It's just a matter of custom and practice now.
Explain your methodology so that people don't call you a nutbag. You're getting all of the death certificates, extracting the data, then compiling it. How are you doing this? Like, what is your methodology?
They can't write me off because everything I'm saying is factually true based on official records from these government entities, and they can verify all of it. I don't get into inferential statistical methods. I do not do confidence intervals and p-values and talk about propensities and percentages like a lot of the research papers do. When I show a graph that these are the number of people who died, you use your eyes and you look at it and you see the jump in 21 that did not happen in 20. And my methodology was originally, I got all this stuff. I don't know what to do with it. I'm an engineer, not a doctor, not a healthcare person. So I started looking in the spreadsheet and I said, well, I'll look for hotspots. So I looked for standard deviations above mean for age groups and semi-monthly periods in a big matrix. There were 2 that lit up in 2021, first half of October and first half of September. And that was in the age group of 65 to 74. So I have those hotspots. Now I've got this huge database of hundreds of thousands of people. And now I can zone in on that and do a filter and look at 300 names. I can look through 300 names. That will take me an hour, and I can look through what they died from. And as I'm looking through, it's supposed to be, COVID pneumonia, ARDS, COPD. That's not what it was in 21. In 2020, that's what it was. So pneumonia and respiratory were up in 2020, as you would expect from COVID. But all of a sudden in 2021, there's cardiac arrhythmia, pulmonary embolism, pulmonary embolism, pulmonary embolism, pulmonary embolism. And when I saw 4 in a row, I was like, oh, geez, something's going on here. I started looking to the right and I saw all these codes. They're international codes for cause of death. And it's how everybody traces the causes. It's how all the health departments, the CDC, they're not looking for the words, they're looking for the codes. And so I did analysis on all the codes. And I looked at all the J codes, which are respiratory, and all the I codes, which are circulatory, and the D codes, which are blood. And guess what? The J codes were high in 2020, higher in excess, but the circulatory and blood were higher in 2021. I found this out over 2 years ago and published it. And since then, I've been getting updates in more states. I have 3 major states plus Vermont. The stuff that I found is just huge.